Friends, I am Dr. Surjit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Tissue Salt Therapy Part 2 Introduction. If you are new to tissue salt therapy, viewing Part 1 is a must. Please remember this. What are the overall substances in human body? In human body, there is about 3/10 solid and rest water by weight. What is the amount of inorganic salt in human body? Of 3/10 solid, 2/10 constitute fat, albumin, gelatin, carbonate, fibrin, etc. and 1/10 constitute various inorganic salts. How many inorganic salts have therapeutic importance? Of all inorganic salts, 12 salts have therapeutic importance which are used as medicine after potentization following Hormesis principle. Names following. Actually, maybe these names have already been given in part 1, but it will be repeated in a few more sessions because that is very important thing. What are the names of inorganic salts having therapeutic importance and used as tissue salts? Full names of tissue salts, 12 tissue salts, are once again given in order on the right hand side. Once again means it has already been, the name has already been disclosed in part 1 also. Now let us know the names once again. Salt number 1, Calcarea fluorica. Salt number 2, Calcarea phosphorica. Salt number 3, Calcarea sulfurica. Salt number 4, Ferrum phosphorica. Salt number 5, Kalium muriatica. Salt number 6, Kalium phosphorica. Salt number 7, Kalium sulfurica. Salt number 8, Magnesia phosphorica. Salt number 9, Natrum muriatica. Salt number 10, Natrum phosphorica. Salt number 11, Natrum sulfurica. Salt number 12, Silesia. Now please note, this number is fixed. That is, whenever you will tell salt number 7, it will be Kalium phosphorica. Whenever once mention salt number 11, then he is telling the name Natrum sulfurica. This number is fixed. Number 1. Number 2, in many cases we have written fluorica, somewhere fluoricum. The fluorica and fluoricum are synonymous. Actually, we have to remember this number, salt number, as well as the name. If you want to know this therapy deeply, you have to remember the salt number as well as the salt name. We have to assimilate the significance of the therapeutic indications of all the 12 tissue salts to be a competent tissue salt therapist. Most important. This is the most important sentence. We have to assimilate the significance of the therapeutic indications of all the 12 salts to be a competent tissue salt therapist. Discussion of the therapeutic indications of all the salts with full explanation would be done in the coming videos. There will be series of videos all over every salt. On every salt there will be a detailed discussion of therapeutic indications. And below you will see 12 small bottles of containing the salts. This is just images just. What are meant by signs of a disease? The physical changes which are visualized on the person of a patient by doctor examiner are called signs of a disease. Examples: reddening of eyes, swelling of joints, eruptions on skin, etc. What are meant by symptoms of a disease? The altered feelings and sensations described by a patient during examination by a doctor are called symptoms. Example: nausea, vertigo, etc. These are just preliminaries of any medical science. We very often refer to signs and symptoms. Mind this, signs means something which are seen, by eyes, and symptoms are which are felt by the patient only. But in general, if we generally refer to symptom, we can take up both the things. Sometimes only signs, but we take both the things. But critically, signs and symptoms are different. What are the different forms in which tissue salts are usually employed? Tissue salts are solids and are employed in trituration, that is powder form, and in pill form. Nowadays, almost everywhere salts are employed in pill forms. Pills may be of different weights. Small pills of 1 grain is the commonest form. On the right hand side, 1 grain pill has been shown. What is the unit of weight of a tissue salt? It is always expressed in grain. 1 grain equal to 0.06 gram approximately. What are meant by dose and potency of a tissue salt? Dose is the amount of medicine employed in a single go. There is another definition. Dose is the simplest amount, is the minimum amount of medicine which can change, perceptible change in the health of the patient. Dose depends on the age of the patient. In tissue salt therapy, common adult dose is 3 grain, teenage dose is 2 grain, child dose is 1 grain. There may be variation, that is someone practices 4, 2, 1, someone 5, 3, 2, etc. The principle is the less the better. In case of medicine, the less the better. Potency expresses the stage up to which a tissue salt is potentized. This is denoted, these potentized medicine are denoted by X form. I mean some numerical, then X, 1x, 2x, 3x, in this way, 6x, 12x, 30x, 100x, 200x, etc. In tissue salt therapy, how medicines are prepared or potentized. I have repeatedly saying this thing, potentized, potentization, potentized medicine. Now we have come in that stage, what is a potentized medicine, how it is prepared. For preparation of medicine, you require 3 things: pestle, mortar, and spatula. On the right hand side is given pestle, mortar, and spatula. Primitive method is being described here because modern method are highly mechanized method. You take crude medicine 1 grain. Suppose you are going to prepare Calcarea phosphorica. You are going to prepare Calcarea phosphorica. You are going to prepare this medicine. Though you take crude Calcarea phosphoricum 1 grain and mix 9 grains of saclac, that is milk of sugar, in the mortar. Then with the help of pestle, you grind. Again with the help of spatula, you collected the fine particles that are attached in the wall of the mortar. Then you again grind. In this way, grinding spatula collection. Grinding collection by spatula. In this way, you have to do this thing for 1 hour. In some cases, it is 2 hours. Then you get 1x medicine. That is, in 1x medicine, in every part of 1x medicine, there is 1 part of medicine and 9 part of saclac. That is, you can call this medicine is a solution of medicine in saclac. Now, to go to 2x, you have to take 1 grain of 1x medicine and saclac 9 grains. In the same way, you will prepare 2x. This will go on. This will go on. So whenever it is going more and more, the medicine is less and less, but the potency of the disease, medicine is increasing gradually. This is the principle of hormesis. What is the standard dose in TST? For adult, 2 grain, 3 grain, 4 grain. Some doctors used to give 2 grain, some doctors used to give 3 grain, some 4 grain. For teen, 1 grain, 2 grain. For child, 0.5 grain, 1 grain. Now you can argue, then what should I follow? You can follow anything you like. But remember that thing, the less the better. If you want to follow this system, the less the better, then 2 grain, 1 grain, 0.5 grain is the best system, I think. Because medicine dose is that amount which brings a change, perceptible change in the health of the patient. What is the time period repetition of dose in TST? A. In severest form of acute diseases like asthma, colic, gastroenteritis, blood dysentery, etc., doses of low potency may be repeated in every 5, 10, 15, 20-minute interval. B. In ordinary acute diseases like fever, cough, cold, etc., doses of low potency may be repeated in every 2, 3, 4 hours interval. C. In subacute diseases, doses of medium potency may be repeated 2, 3 times a day. In chronic diseases, doses of high potency may be repeated once a day, twice a week, once a fortnight, or once a month. When you will grasp the medicine dose, potency, and repetition, you will understand that this is the most important thing of practice. You have to understand how soon or how long I will wait after giving a medicine, and when, and what is in what stage of the disease. Everything you will understand. Just time, and patience is required to learn the things. General procedures to follow during follow-up of a patient. A. Depending on the situation, one may have to increase or decrease repetition of a medicine, such as in the case of a chronic disease, when high potency is giving desirable effect, one should stop giving medicine and follow wait and watch policy. Sometimes one may require repeat low potency, often to hasten the process of cure. Again, you may need to repeat the same potency or higher potency. B. In case of an acute disease, when the intensity of the disease is on a low ebb, one should increase the time gap of repetition of the medicine. C. When a medicine does not show any effect, aggravation or amelioration, there is no change in a chronic case, after a considerable amount of time, one should reconsider the whole case. There are two dots. Note कीजिए. There are two dots. This two dot means this particular heading is continuing. General procedures to follow during follow-up of medicine is continuing. D. In severest form of an acute disease, one may have to apply medicine every 5 or 10 minutes after. In such a situation, dissolve 20 grains of medicine in 10 to 12 ounce of warm distilled water and give a teaspoonful of that distilled water in the mouth of the patient at every desirable interval of time. That is, in such case, no direct 3 grain, 2 grain is employed. Rather, a handful of grains, that is 20 grains, is dissolved in 10 to 12 ounce of water, and that water, that is the water in which medicine is dissolved, is given at short interval of time. What are meant by placebo, vitam, nihilum? During treatment, especially of chronic diseases, a patient may be required to put on no medicine for wait and watch or other reasons for a pretty long time. In such a situation, pills or globules of just plain sugar of milk is employed to patient for mental satisfaction. Above names are used for this purpose. Above names is placebo, vitam, nihilum. This is called no medicine.